do have to be bolder, we got to be wiser, we got to be stronger, so that we can protect our health and healthcare. And so we've been doing this series, Making the Healthcare System Work Better for You, to really create a more empowered community of Black Californians who can do just that and take ownership of their health and well-being. And so we've talked about in the past your patient rights, how you communicate with your healthcare providers. Last session, we talked about being an empowered healthcare consumer, where we gained a deeper knowledge and understanding about how to take ownership of our health and healthcare. Today, we're going to talk about how to work with your healthcare team and your health providers, and specifically the different type of healthcare providers that could be part of your team. So Dr. Melissa Clarke will tell us all about that shortly. But in addition, I think one of the things that interests me the most for this session is we'll learn and talk about holistic and alternative medicine options, or complementary and alternative medicine options, as sometimes it's referred to. So in addition to your primary care team, there are non-allopathic providers that you can add to your team that really focus more holistically in getting to the root causes of health conditions, which I think is very important. And so it's even more important for us to start talking about and thinking about these things now, especially as the One Big Beautiful Bill Act is really changing and reshaping Medicaid, Medicare, and other health programs here in the US that are meant to just make sure that our basic needs are met. And so, again, I think it's going to be more critically important that we become empowered healthcare consumers so that we can stay informed about these policies and changes that may still happen along the way, that we can actively do what we can to do our part to make sure we contain or get and keep our healthcare coverage and healthcare plans, and then make sure that we're able to advocate for ourselves and our loved ones. And if you're trying to research and do information about your health and health conditions, just please make sure that you use a trusted resource to help you understand and also make smart decisions. So we are very fortunate to have Dr. Melissa Clarke, who's our subject matter expert for this series, and she is the author of a book called Excuse Me, Doctor, I've Got What? So she wrote the book to really be sort of a way to teach healthcare consumers about how to communicate, how to navigate, how to advocate for themselves when they're interacting within the healthcare system. And so I know Dr. Clarke has some really valuable information to share today, but before we do, just a few housekeeping rules. As per usual, please put your questions in the Q&A box. The chat box will be open if you want to give a shout out to somebody that you see that you recognize, or just say hello, tell us where you're from, no matter if you're in California or outside of California. And then please note that everybody will remain on mute and off camera during the session. So before I introduce Dr. Clarke, I'd just like to, for those of you who may be new to CBHN, just talk a little bit about who we are and what we do. So we are a 40-plus-year-old organization. We are the voice and trusted resource for Black health equity in California. And I say we are the only Black-led statewide organization that is dedicated to advancing health equity. And I think for all Black Californians, that includes African Americans as well as Black immigrants, regardless of what country of origin they are from. We conduct outreach, education, advocacy, and policy work to achieve health equity for Black Californians. And we do that through the lens of understanding what the critical issues are that lie at the intersection of racial justice, social justice, and environmental justice. So our vision is to create a California where every African American and Black immigrant has the opportunity to live a life that is a long, healthy life free from violence, racism, and health inequities. Going to be more challenging to do that as the next 2 years unfold, but we will work tirelessly every day to ensure that we still are working towards achieving that goal. And we do that every day through ensuring that all Black Californians, regardless of their education level, how much money they make, where they live, what their sexual orientation is or how they identify, or even their housing or immigration status, really has access to high quality and equitable primary as well as behavioral health care. And definitely focus on prevention so that they can avoid succumbing to diseases, and especially those that are preventable. And so I will introduce Dr. Clarke and turn it over to her shortly for her to, talk more about the content and what the focus is for today and how we really go about creating that right healthcare team. So Dr. Melissa Clarke is an author, TEDx keynote speaker, health show host, thought leader, physician, educator, and population health expert. She is a Harvard-educated emergency medicine physician with over 30 years of healthcare experience. She's been on the front lines of addressing health disparities, health literacy, and improving the way doctors and patients work together for quite some time. She is a medical contributor for the Russ Parr Morning Show and has made numerous television and radio appearances, including on CNN. So her book, as I mentioned earlier, Excuse Me, Doctor, I've Got What, is a roadmap for how to be a smart healthcare consumer and understand why now more than ever taking control of your health and healthcare is more important. So based on the book, Dr. Clarke is the host and co-creator of Excuse Me, Doctor with Dr. Mel, a live weekly health forum on SiriusXM and streamed on YouTube and Facebook. If you don't have a subscription to SiriusXM, so where she provides urgent information and answers audiences' questions in real time every Monday night at 6 p.m. Pacific, 9 p.m. Eastern Standard Time. She has served as a keynote at different conferences and has, I don't know if she still has an upcoming TED Talk, but she did a TED Talk called Blue Wall, White Wall, Linking Equity in Healthcare and Policing. I mentioned she graduated from the Harvard Medical School and the University of California, San Francisco School of Medicine, and completed her residency at George Washington and Georgetown universities. And so without further ado, I will turn it over to Dr. Melissa Clarke.
Good afternoon, everyone. And Rhonda, as always, thank you for that wonderful introduction and also setting up what our topic for today, Stronger Together, knowing and working with your healthcare team. And wanted to see if we could switch to the first slide. While we're waiting to get that up, I see all the various greetings from all over the state. Welcome, everyone, coming in from all the various places in California. Great to see that.
So you're not able to share on your end?
Oh, I thought I was already sharing, but I
Nope,
will
but try it again. Yeah, sorry.
reshare. Yep, no worries. Okay, you should be seeing it now.
Yeah, yes, we can see it now. Thank you.
Fantastic. All right, so Stronger Together. Rhonda mentioned that I requested the song because it talks about you got to be stronger. And one way to be stronger when we talk about health and healthcare is knowing the members of your healthcare team and how to work with them. And I define team very broadly, as Rhonda mentioned, because I also think too that there is a role for complementary and alternative medicine working alongside Western medicine or allopathic practitioners. We're going to hear the difference between the two and when it's appropriate to include other members of your team or on your team. So, I'm going to just talk briefly about what we're going to cover today. So, we're going to learn who makes up your healthcare team and how each member supports your care. I have some case examples. I'm going to work in there so you can kind of understand how these team members can work together and what positions they each play when it comes to maybe some common conditions that you may have heard of, experienced, or had in your family. And then we're going to understand how to find the doctors and providers who are the right fit for you, and then also gain some tips for building open and clear communication with your healthcare team members. So we have a lot of different roles on the healthcare team, but I would say the central position should be occupied by your primary care physician. That should be the person who is essentially the quarterback of the healthcare team. You're the coach, right? So this is the quarterback of your healthcare team, the person who coordinates all the different members, whether you're seeing specialists, um, whether you're also engaging with complementary and alternative medicine, they should know. Um, and this is oftentimes your first point of entry into a healthcare system. If you have a complaint, or a symptom, you're not sure, what system of the body it's related to, you start with your primary care physician, and then they can refer you as appropriate. Of course, nurses play vital roles across our healthcare system. Whether you're in the hospital, they might be a bedside nurse. If you're being seen in a clinic or a doctor's office, oftentimes they can be the person that you first interface with to tell your concerns to. And often, and nurses actually go on to get advanced degrees. So you might have heard of nurse practitioners. They actually can function as primary care providers and be your and serve the role of your primary care provider. Case managers and social workers. I wanted to mention those pretty early on because as this concept of team members has evolved, there has been and a doctor or a healthcare provider not being able to take care of all your needs, obviously. The idea that 80% of our well-being or 80% of our health outcomes actually are not related to what happens in the doctor's office. It's related to what happens outside the doctor's office. So where we live, where we work, where we play, where we play, our socioeconomic conditions, our educational background, whether we have transportation in our communities, whether it's accessible to us, what is our housing status? Um, all these factors play a critical role in your health outcomes. Oftentimes, social workers are a critical part of the team because if you're having social barriers to getting care, your social workers are the ones that can help you address that. And so they have become an even more integral part of the healthcare team. A case manager is someone who can work alongside the social worker and really help to coordinate your care. So, if you're, for example, struggling with a cancer diagnosis, a case manager can help you make sure that there's coordination among the different types of doctors that you're seeing. Make sure um, that your appointments are all lined up for you. If you're having trouble with your medications, they can get you to the right person. And of course, as I mentioned, medications, the next person on the team who should be an integral part of your team is your pharmacist. If you have a medication question, of course, you can go to your primary care provider or the doctor who prescribed it. But if you want to find out more about that medicine, how much it costs, what the side effects are, is it a concern to combine it with existing herbs or medicines that you're already taking? Your pharmacist should be your first point of contact. It's great if you have a neighborhood pharmacist that you go to who knows you, and that's where you get your medications filled because you can develop a relationship with that individual to really make sure that you're getting the best advice around your medications. Health navigators and peer support specialists. These are individuals who they don't have formal medical training, but they have what's called lived experience. So, for example, if uh, you're dealing with a behavioral health diagnosis or are in recovery from a substance use disorder, these are individuals who've walked that path before and who can provide support to you from a layman's standpoint, but really also help you navigate some of the day-to-day challenges that you might be having. And come to be very valuable members of the healthcare team, providing that mental health support, providing the social support oftentimes that's needed when you're navigating the healthcare system and have a challenging diagnosis. Nutritionists, huge. We know that food is medicine. And if you have a new chronic condition that's been newly diagnosed, chances are that nutrition is going to play a huge role in managing that condition and improving that condition. And so I encourage everyone when they have a new diagnosis, regardless of what it is, whether it's rheumatoid arthritis or diabetes or high blood pressure or a cancer diagnosis, to ask your primary care physician or whoever made the diagnosis to give you a referral to a nutritionist so that you can work through with that individual what are the best foods that you should be focused on, what you should be avoiding, and how to do it within your budget. They're excellent resources for that. And then there's a whole rehab team. These are your speech therapists, your occupational therapists, um, your physical therapists, who, if you've had an injury or you're recovering from a stroke or some other condition that affects your ability to move, to talk, to think, to write, these team members who are considered rehabilitation experts are ones that you're going to interact with. So it's really important to not just know who's on your team, but know how to work with them, know what role they play, and how to best interact with them. So I'm going to next talk about all the different kinds of physicians there are. And um, just to first level set, there are different kinds of physicians. Allopathic medicine physicians are ones who you're probably most familiar with. They have MD behind their name, and they are divided into whether they're primary care doctors, meaning generalists, versus specialty care doctors or specialists. And we'll cover those differences. And then if they're specialists, do they focus on um, intervening using surgery, or do they primarily rely on medication and lifestyle change? So we're going to launch into a discussion of these different kinds of doctors and the roles that they play. So first I want to talk about the medicine-based physicians. So with those are ones that rely primarily on medications and lifestyle changes to do the interventions to address symptoms, conditions, diseases, or prevent these things. So let's start with the primary care, the generalists in this area. So that's going to be your pediatrician. That's going to be who takes care of you from age 0 to age 18. And then family medicine doctors. Well, what's the difference between a family medicine doctor and an internal medicine doctor? They essentially do the same thing in that they're generalists. You go to them as the first line of defense. They play that quarterback role on your healthcare team. But family practitioners take care of all age groups. So from they can see children, they can take care of pregnant women, and they take care of adults into the senior ages. Internal medicine physicians only focus on adults. So age 18 and over, they don't take care of pregnant women. They only take care of non-pregnant women or non-pregnant people, individuals age 18 and over. A subspecialty of internal medicine is our geriatrics, right? And they can again take care of anybody over 18, but they specialize in seniors, so individuals age 60 and older, because seniors have special needs, especially when it comes to medications. Oftentimes you have to adjust the dose of your medications if you're a senior. There are special considerations around um, cognition and thinking, balance, um, the way that your body changes and what's considered a normal blood pressure, for example, at an older age. So the senior population has specific considerations, and I encourage you, if you're a senior 60 and older, to investigate whether it would be better to have a geriatrician as your primary care physician. Now, these other um, uh, providers listed, physicians listed, are all people who started out as uh, probably internal medicine doctors, but decided, hey, I want to specialize in a particular area. And so let's start with your neurologist. These are doctors who focus on the brain and the nervous system. Psychiatrists are the ones who diagnose and can prescribe around mental health and mental health conditions. Pulmonologist, those are lung doctors that specialize in lung conditions. Cardiologist, the heart. Nephrologist, the kidney. Rheumatologist, the joints. And gastroenterologist, the stomach and the intestinal system, all the way down to the rectum. And an endocrinologist is one who there's not a particular organ, but they focus on your hormonal system. So that's your thyroid hormone. Insulin is a hormone. So these are the doctors you go to if you have diabetes, anything wrong with your thyroid, anything wrong with your growth hormones. So anything having to do with your hormonal system, your endocrinologist is where you would go. There are additional specialties that also don't correlate to a specific organ system that can be pictured on this slide. So those are going to be your hematologist, oncologist. So that's one specialty, and it means they focus on the blood system. So heme means blood. So if you have sickle cell, for example, you might have a hematologist. They also focus on oncology. So oncologist is cancer. Any cancers, if you're diagnosed with it, chances are you're going to go see a hematologist oncologist who's going to help um, pinpoint what kind of cancer it is, how far progressed it is, and then prescribe a chemotherapy regimen for you based on that. So those are your hematologist oncologist. Infectious disease. These are doctors who focus on diagnosing and treating if you have an infection. And that includes everything from pneumonia, COVID-19, overwhelming bacterial infection you might have heard called sepsis, sexually transmitted diseases, any kind of infection that you can think of, that's what their specialty covers. And last but not least, among the medicine-based physicians are allergists and immunologists. Very important people that have seasonal allergies, might have food allergies. These are the doctors that help to pinpoint what you might be allergic to and find the treatment for it. They also do immunology. So if you have a problem with your immune system, this is the kind of doctor that you would see. And then last but not least, going back all the way to birth, neonatologists are doctors for newborns, especially they're needed when a child is born prematurely, and they might need life support, they might need nutritional support. So these are going to be the doctors. They only practice pretty much in the hospital because they need all the equipment that's needed to keep newborns alive if they're born prematurely. So these are examples. I named some examples of common conditions as we went along, but I just wanted to add for a cardiologist, uh, for if you have a heart attack or you've had a heart attack, if you have heart failure, if you have a problem with the electricity in your heart, one of the more common ones that you might have heard about is AFib, which stands for atrial fibrillation. Cardiologists are the kinds of doctors that you're going to see if they're one of these conditions at play. A neurologist, again, I mentioned that they cover the brain and nervous system. So that's going to be if you've had a stroke, if you have Parkinson's disease or dementia. These are the doctors you're going to see. Multiple sclerosis, which is a condition of the nervous system that gradually causes you to have weakness or tingling or numbness in different parts of your body and might eventually lead to paralysis. We know it's more common in women. It's actually more common in Black women. You might know someone in your family or in your circle who's had multiple sclerosis. Neurologists are going to be the doctors that manage all these conditions. Pulmonologists, last example, um, people who've had a long smoking history may have had destruction to the substance of their lung. And they developed a condition called COPD, which stands for chronic obstructive pulmonary disease. This is a common condition of people that we know have smoked for a long time. Chronic bronchitis, it's also called. A pulmonologist is going to be your doctor who helps to manage that condition. Of course, asthma at any age. Pulmonologists are going to be your specialists that you go to. Or if you have recurrent bouts of pneumonia or some kind of unusual pneumonia, these are going to be the doctors who you go to. Of course, they were very busy during the height of the COVID epidemic because they were managing a lot of the people who developed severe pneumonias as a result of the COVID-19 virus. So let's talk a little bit of a case study, right? This is Corey. He's 4. He recently was diagnosed with asthma. The symptoms that he had leading up to that were nighttime coughing. When he would go out and play, his mom would notice that he would come in and he'd be making this wheezing noise. That's what it sounds like. And then she took him to the urgent care a couple of times for these symptoms. And his older brother and his mom both have asthma and they have seasonal allergies. So, who might be on Corey's healthcare team? Well, the first stop is probably going to be his pediatrician, or it could be a family medicine physician, but basically, or a nurse practitioner, but a primary care physician who his mom takes him to explain the symptoms and sort of get that first line diagnosis and treatment. Now, because if his asthma gets severe, that primary care doctor, whether it's a pediatrician or a family medicine person or a nurse practitioner, may choose to refer Corey to a lung specialist, a pulmonologist, or a pulmonary specialist. And that person, that doctor may say, "Hey, we've seen now that Corey's been on this medicine that his primary care provided for 3 months, but it seems like it's not really keeping him from having these asthma symptoms. Let's try a new medicine," right? And so that doctor may do some more diagnostic tests and may change the treatment plan if the treatment plan that was developed initially isn't working as well as we want. And then, maybe the pulmonologist notes, oh wow, Corey's asthma seems to be worse in the spring, and we know that his mom has a history of seasonal allergies. Let's send him to an allergist to figure out, are there specific triggers for his asthma that need to be avoided, or we maybe need to change our medicine to also address our medication regimen to address this particular issue. So Corey would then go to the allergist or immunologist. And then, of course, the pharmacist. Like I said, if you're on medication, a pharmacist should be part of your team to help explain what are the side effects. So if Corey gets prescribed a rescue inhaler and his mom notes, wow, when he gets that rescue inhaler or takes that nebulizer, his heart's racing. Is that something I need to be concerned about? She could ask the pediatrician the pulmonary specialist, or she could ask the pharmacist. The pharmacist would explain that's a common side effect that you shouldn't worry about, but it's commonly seen and it should go away within an hour or two of getting the medicine. And then finally, a social worker. We found out from the allergist that, hey, turns out that Corey is allergic to cockroach droppings, right? And Corey lives in a apartment complex where there's a cockroach problem, right? And so a social worker might be brought in to negotiate with the building owner to make sure that exterminations happen on a regular basis so that Corey no longer has to be allergic to or be exposed to the what's triggering his asthma. So that's how a well-coordinated team might work for Corey. Let's do another case study now. Corey was 4. We have Miss Laverne. She's 74, and she recently, unfortunately, experienced a stroke. She has a history of having a diet high in processed foods, mainly because she's on a fixed income. She has to buy, a lot of canned goods because that's what she can afford. They're high in sodium. They pushed her blood pressure up. She's been getting a little forgetful, so she forgot to take her blood pressure medicine. And she sometimes skips having a more balanced meal. And so, unfortunately, she ended up with a stroke. So, and a stroke, just so that everybody knows, is when the blood supply to a certain part of your brain gets cut off and that part of the brain dies. And if it's a part of the brain that's really crucial in controlling some aspect of your body, your speech, your vision, the movement of the right side of your body, the movement of the left side of your body, whatever it might be, you might then have a permanent problem with that um, with that bodily function. So, who might be on Miss Laverne's team after she leaves the hospital? Well, her primary care physician should immediately follow up with her within 7 days of her leaving the hospital to note any new medications that she's on and make sure that those medications are going to be renewed. He might help her to find, or she might help her to find a neurologist. We talked about neurologists being the ones who specialize in stroke care. Um, a cardiologist. Now, why would a cardiologist be needed? We talked about a cardiologist being a heart doctor. Well, oftentimes, one of the reasons that people have strokes has to do with their blood pressure being out of control. So the cardiologist would focus on that. Or it could be because they have an abnormal heart rhythm. I talked about atrial fibrillation. And what happens is your heart isn't pumping like it should. So blood sits in your heart, it doesn't exit the heart. Blood clots form. And one of those blood clots could then migrate up to your brain, get stuck, and that cuts the blood flow off from your brain. So the cardiologist can help to um, address if that's one of the reasons for your stroke. And anybody who's had a stroke should have an evaluation by a heart doctor, by a cardiologist. Nutritionist. I talked about Miss Laverne's financial challenges, being on a fixed income. Um, how could that nutritionist help Miss Laverne come up with a more balanced meal plan that's affordable to her, that doesn't rely on high salt foods? And then her rehab team, when she was in the hospital, she probably saw a physical therapist, um, an occupational therapist. Occupational therapy helps you to reestablish your day-to-day functions, right? So being able to cook again, being able to get in and out of a car. So they help you with tasks, everyday tasks, and being able to accomplish them. Physical therapy merely or specifically helps you with strengthening and coordination. And speech therapy helps with your memory. So when she leaves the hospital, she should continue to get those services. She might go to um, a short-term rehab facility, um, which she could stay there any time from 2 to 4 weeks before she goes back home. Or if her stroke was mild, she might go straight home, but she needs to either have the rehab team come to her house, or she needs to go to a rehab facility 2 or 3 times a week to work on reacquiring her skills. Pharmacist, we already know, but won't go over the pharmacist again. Chances are she got started on a bunch of new medicines because of the stroke, and so that pharmacist should know what those are and be able to talk through what they are with her. And then a therapist. Um, if she has any degree of depression, which oftentimes goes unrecognized in people who've had strokes, it kind of comes along with the territory. It would be good for her to sort of, as she adjusts to her new level of functioning, be able to talk to a therapist or a psychologist to be able to better manage her new type of life that she has and her new quality of life without letting depression um, hold her back. And I should mention I can't see the chat, so if you drop a question in the chat, maybe if one of the CBHN team members can stop me and I can answer the question as we go along because I know it's a lot of information. But feel free to throw your questions in the chat and I will answer them as we go along.
So
Um,
I'm sorry, Melissa actually, I asked people to put them in the Q&A box so that they won't get lost in the chat. But
oh,
either way,
yes.
if you have
Okay.
questions, please post them in the Q&A box. I think there may be one on the way.
Okay, fantastic. Or if you even want to leave a comment because you've had experience with one of these kinds of doctors because of through a family member or facing a health challenge of your own and want to share your experience, I'm happy to talk through those at the end as well.
Yep.
All right, so
Dr.
we covered the,
There's a question about this slide. Would you like to take it now or would you like to wait to the end?
no, happy to take it now.
So the question is, if a patient comes in with shortness of breath, chest pain, and dizziness, which two specialists from this diagram might be relevant to consult and why?
Oh, that's a good question. So, um, I was gonna go back, but actually, if it depends where they come into. I would think that if they had those symptoms, they would go to the emergency department because shortness of breath, chest pain, and dizziness could mean that they're having a heart attack. And that's not something that you want to wait and schedule a visit with your primary care. You want to go to the emergency department right away to make sure that it's nothing serious. It could be a panic attack, right? Which is, not life threatening, but very scary. Or it could be a heart attack. Um, or it could be something with your esophagus. There are multiple possibilities with those symptoms. So I would go to an emergency medicine physician. Uh, to make sure that it's nothing life threatening. And then afterwards, once the emergency medicine physician evaluates you, determines what the problem is, if you need to be admitted to the hospital or not, if you're going to be discharged, the emergency medicine specialist would then determine what's the best person to see based upon the diagnosis they came up with. So I know that's not like a definitive answer, but those symptoms are, again, could have multiple things going on. The most important thing is make sure it's not life threatening. All right. So, the next section to go over, we talked about the medicine based physicians. These are the surgical physicians. So, surgery is the primary treatment that this group of specialists use. So let's start with neurosurgeon, start at the brain down. These are going to be doctors that operate on the brain. So if you have a bleed or bleeding in your brain, you have brain cancer, you're going to see a neurosurgeon. They also operate on the spine as well. So you might have heard of people with accidents that injure their spinal cord and they end up paralyzed, neurosurgeons are going to be the ones to operate on them and restore stability to the spine. Ophthalmologists, they focus on the eyes. So not only do they check your vision and prescribe prescriptions, but they also can do, uh, uh, yeah, prescribe prescriptions and treat you for things like glaucoma. But they also can do surgical procedures. For example, if you have cataracts, they remove cataracts from your eyes. In my late 20s, had LASIK. I used to wear Coke bottle glasses. And so I had an ophthalmologist who fixed my cornea and made it so that I didn't need glasses anymore. Um, so they do surgical procedures on the eye. A plastic surgeon. I know y'all probably seen Botched or any number of of shows that mention plastic surgery, Brazilian butt lifts, all those things. But they basically do operations that help with appearance. Some of them may be medically necessary, meaning uh, important for your health, and some might just be cosmetic, important for your looks. If they are just for your looks, they're probably not going to be covered by insurance. But if it's something that is important for your health, it probably will be covered by your insurance policy. An otolaryngologist, also known as an ENT doctor, ear, nose, and throat. Those are going to be doctors that do surgery on on those body parts. So, for example, if your child has recurrent ear infections and needs tubes placed in their ears, you're going to be seeing an ENT doctor for that. Vascular surgeons, those vascular means blood vessels. They operate on blood vessels. One common kind of surgery is as people get older, especially if they've been smokers, they might have the blood supply to their legs or the blood supply to their brain going through their neck blocked. So these doctors open up blood vessels. They might do replace blood vessels with grafts just to make sure that your blood vessels stay open and blood continues to move through your system. Cardiac surgeons, they operate on the heart. Um, if you have blockages of the blood flow to your heart, ending up with a heart attack, a cardiac surgeon might be the one to go in, or a vascular surgeon to go in and open up the blood vessels going to your heart to restore blood flow. Bariatric surgeon. So you might have heard of a gastric sleeve surgery or oh gosh, I'm blanking. Um, I can't think of it, but Al Roker had it. Basically, these are surgeries for weight loss where they might change the way that your stomach looks or the way that food moves through your system so that you can lose weight. And it's extremely successful surgery. We find that Black people don't often take advantage of it. If you have obesity, if you're overweight, and you have diabetes, for example, and you get one of these surgeries, it actually cures the diabetes along with helping you lose weight.
Is that
So
gastric bypass surgery?
gastric bypass, yeah. I don't know why I was blanking on that. Yes, exactly. Um, then a colorectal surgeon. Again, the colon and the rectum, if you have colon cancer, any kind of a bowel obstruction or blockage in your bowel, you're going to see a colorectal surgeon. A urologist operates on the urinary system and the male reproductive system. So they might be the person that you see if you have prostate cancer and your prostate needs to be removed. An orthopedic surgeon, if you break a bone, you're going to be seeing an orthopedic surgeon. They focus on the bones and joints. A dermatologist, they treat skin conditions. And I listed them here because they also do surgery. They might do a biopsy or remove a mole or a growth on your skin. OBGYN, of course, they uh, assist in, or they deliver babies. They also take care of women through their reproductive years and beyond. And they do procedures like hysterectomies or fibroid removal, or cesarean sections when you're C-section, when you're going to have a baby and there might be a problem with the baby coming out of the birth canal. And then finally, a general surgeon. I left that for last, but even though they're called general surgeons, which means that they potentially could operate anywhere in the body, it really is only the specialists that of all the different specialists that I named that really do all these specialized surgeries. General surgeons typically operate in the abdomen. So if you have an appendix, your appendix needs to be removed, or your gallbladder needs to be removed. There, a general surgeon, 9 times out of 10, is going to be the one to do that operation. So those are all your surgery-based physicians. I kind of covered some of the common conditions as we went along, but plastic surgeons, nose jobs, breast reconstructions after mastectomies for breast cancer, vascular surgeons, I talked about those examples, and a colorectal surgeon. If you have hemorrhoids or colon cancer, that's going to be the doctor that sees you. Let's see. So the next case study, it looks like the video is going to play as soon as I go to that slide, but I'll let you listen to the video and then we'll go over the case study.
Blood clot in my lungs. Huge blood clot in my lungs. Pray anybody for successful surgery and great recovery and a testimony. How God is, God's will is God's will.
So this is a comedian Guy Torrey. Just 2 weeks ago, he underwent surgery to remove a large blood clot from his lungs called a pulmonary embolus. It's actually the same thing that Heavy D died from. And you may know friends or someone in your circle who's had that kind of complication, but it's very scary. And so he went on social media, asking for everyone's prayers right before he went into surgery. His symptoms were that he had shortness of breath. And this is one of the diagnoses when you said shortness of breath, chest pain, and dizziness. This is one of the sort of first things that potentially comes to mind is a blood clot in the lungs. But Mr. Torrey actually dismissed his symptoms as exhaustion initially because he had this busy touring schedule. But eventually I think he collapsed on stage and he was rushed to the hospital and this diagnosis was made. So who might be on his team? Well, when he goes to the emergency department, he's going to see an emergency physician, but they're going to probably call a lung doctor, a pulmonologist, and a cardiothoracic surgeon, because that's who's going to do the operation to remove the blood clot. And then when he gets out of the hospital, he's going to follow up with his primary care physician, who's probably going to do some additional tests to see if this is a inherited condition, and then make sure that he's on the right maintenance medicine for the right amount of time to prevent this from happening again. Depending on how long he stays in the hospital, if he gets deconditioned, meaning his muscles, because he's laying around in the bed, he loses some strength, he might need to go to a physical therapist to get some of his strength back. And then finally, of course, the pharmacist, who needs to be on everyone's team. And then these are the last set of doctors. I've mentioned an emergency medicine specialist. That's what I am. That's who you see when you go to the emergency department. And we're trained to cover all kinds of emergencies and intervene with life-saving procedures. So we do some minor surgeries, minor procedures, as well to make sure that that happens. A pathologist, they're the ones that they look and make diagnoses with a microscope. So these are going to be, they're specially trained in looking at things and making diagnoses that are at the microscopic level. Radiologists are ones that read x-rays, CAT scans, MRIs, and interventional radiologists are specially trained radiologists who actually use catheters. They use wires in the body for different purposes. One is, for example, if you have fibroids, they can stop the blood flow to the fibroid so that the fibroid goes away and you don't need surgery. They can, again, use special wires or catheters to go into your heart and to open up the blood flow to your heart. So they do a lot of manual procedures above and beyond their radiology training. A physical medicine and rehab specialist, those are doctors that help to determine what the rehab team should be working with you on. So someone who's been in a really bad car accident, somebody who's been paralyzed, they're going to have a physical and medicine rehab specialist doctor on their team to help determine what their recovery trajectory should look like. An anesthesiologist or pain specialist, they're going to be the ones that put you to sleep before a procedure. They also can, if you have chronic pain, they're also trained to help do certain procedures that help to decrease your pain. And then a palliative care specialist also focuses on pain, but it tends to be with diagnoses that are chronic, like cancer, where there's ongoing pain, and they help to address your pain holistically, thinking about your psycho-spiritual and physical well-being. In the interest of time, I'm going to skip over the common conditions because I covered them. And Damon is a 44-year-old man. This is the last case study, who was diagnosed with diabetes. He was found unconscious at home. The condition had developed without him knowing, but he had a high-stress job. He had poor sleep habits and a lifestyle that didn't really prioritize regular exercise or adequate fiber in his diet. And he saw an emergency physician because he went to the hospital unconscious. But all these doctors, because diabetes affects so many areas of your body, you're going to need a neurologist because it can affect your nerves, a vascular surgeon, it can affect your blood flow to your legs, a heart doctor because it puts you at higher risk for heart attack, nephrologist because it puts you at higher risk for kidney disease and kidney failure, an ophthalmologist because it affects the blood flow to your eyes, which can affect your vision. An endocrinologist, as I mentioned before, they deal with the hormones in your body. Insulin is a hormone, and diabetes is caused because your body is no longer producing enough insulin or responsive to the insulin that you do produce. So endocrinologist is key. A podiatrist is a foot doctor. So they're not an MD, they actually go specifically to podiatry school. And diabetics can have, because they lose sensation in their feet, they get injured easily and they can have wounds that don't heal easily on their feet. So they need regular foot checkups. So that's the podiatrist. And then the psychologist or therapist, again, is there for those who have that diagnosis and may have depression as a result of all the different complications that can result from diabetes. So I wanted to talk about having other modalities that complement the treatment that you're getting, because I think it's really important to understand that there are not a lot of cures for chronic disease. And so from an allopathic, from a Western medicine point of view, and a lot of them really rely more on lifestyle changes. And so there are other forms of medicine that help to, and healing traditions that really help you to address the underlying cause of why you might have a particular issue. Acupuncture in traditional Chinese medicine is a whole nother paradigm that thinks about disease and healing differently than Western medicine. They think of the body as an electrical grid, and they use needles or pressure to undo blockages of the flow of that energy through your body. And it has been shown to especially work very well with pain, addiction, are two of the ones that the World Health Organization has recognized acupuncture to be very good at helping to treat. Ayurveda is an Indian medicine, the country India tradition that really thinks about maintaining balance in the body, mind, and spirit through proper dietary habits and lifestyle habits and the use of herbal remedies. Reiki is an energy medicine, again, thinking of the body as energy, and by using sort of the laying on of hands, but not necessarily touching your body, manipulating the energy of your body, it can help to keep your body in balance. It can be used from a preventive standpoint, or if you have an ailment, especially pain. And then chiropractic is manipulation of the spine to help restore spinal alignment, oftentimes, again, used to relieve pain in various parts of your body. I think it's really important that, you go to, this is how I suggest doing it, go to a Western medicine physician to get a diagnosis and to get started on treatments and understand how important it is to address something right away. And if it's something that you don't have to address right away, then bring in, if you are so predisposed to think about some of these other complementary and alternative medicine therapies, to then bring them in with the knowledge of your primary care provider, and work again as a team in also incorporating some of these into your treatment plan. Other types of physicians, osteopathic physicians, just like medical doctors, MDs, they have DO after their names. They do the exact same things that medical doctors do, but they also do spinal manipulation like chiropractors do. Naturopathic physicians, they also go to a 4-year school for naturopathy, and they focus more on the use of herbs and lifestyle for addressing prevention and treatment of diseases. You might also see a kind of doctor call it integrative medicine physician. They're primarily MDs or DOs, osteopathic doctors, who also incorporate some of the principles from naturopathy into their practice to integrate Western and complementary traditions. And then I know we're at time. And so what I'm going to suggest that we do is that I'll incorporate the rest of the talk into session 4. I have probably about 4 more slides to go, but they're really important. I don't want to rush them, and I want to take some time for questions if you have them. And I think I can integrate them into the next talk.
Yes, there are some questions in the Q&A box. So Anthony wants to know, after a stroke, which member of Laverne's care team would focus on helping her relearn daily activities like walking and speaking? And why is this different from the role of the neurologist?
Great question, Anthony. So the neurologist is going to have more of a medical approach. They're going to prescribe the medicines that Miss Laverne needs to be able to keep her blood pressure in control, to thin out her blood so she doesn't have a stroke again, to understand some of the underlying reasons why she had the stroke. The rehab team is the one that's going to help her to learn how her skills for daily living, getting her strength back, being able to get her coordination back or her speech back, or be able to get in and out of a car easily. And so those are the physical therapist, the occupational therapist, and the speech therapist.
Okay, second question is from Coretta. Hey, Miss Coretta. What about ophthalmology? This is important for children and older adults with medical concerns affecting their vision.
Yes, I mentioned ophthalmology. I had them on the surgical uh, specialist slide because not only do they prescribe medicine for eye conditions like glaucoma, so they're right here, they also, and they check your vision, they can prescribe a prescription for glasses, but they also do surgery to, I gave the example of removing cataracts or uh, treating vision problems. Like I gave the example of I had Coke bottle glasses and they operated on my eyes, so I don't need glasses anymore. They might correct strabismus or lazy eye and sort of realign your eyes. So yes, very important member of the team.
Great. And then I just heard something about this over the last couple of days from someone else, but Monica says, my experience with specialists that you are referred to who are trying to diagnose your condition, but they tell you to come back in 6 months, but you don't get a full diagnosis, and it's a very long time to wait for a diagnosis with no treatment or an answer about what is going on with you.
I agree 100%. And that's one of the communication pieces that I was going to cover is it's important to really stay in touch with your primary care and your specialist. 6 months is an unacceptable time to wait. Oftentimes, when you're told to come back, they are trying a treatment or sending you for additional testing to try to figure out what the problem is. And they're giving a 3-month window for you to either try a treatment or get the necessary testing. 6 months, I actually haven't heard that. That's kind of, I think, unacceptable. I agree that's a long time to wait for an answer. And I would probably get a second opinion if you're being asked to wait 6 months before you get a diagnosis.
Right. And I think this is a perfect example of where where and why it's important for you to advocate for yourself, but also knowing your rights. Yes, if this doctor that she's talking about isn't really, have your best interests at heart or really caring about you as a patient, then yeah, I think it would be time to maybe switch to another doctor. But also it's important to be able to um, advocate for yourself and maybe amplify your voice so that you can get a more timely appointment and diagnosis.
And also I would add sometimes it's just a matter of the communication. The doctor hasn't communicated clearly. Not that they don't have your best interest at heart, that sometimes can be the case, but sometimes it's also they've communicated, they think they've been understood, but they haven't because they didn't communicate well. And so there's a misunderstanding on your part as to what their actual intentions were. So if there's anything like that where you feel this is just beyond the pale, you're asking me to wait 6 months, again, that advocacy, challenging it, asking, that seems unacceptable. Did I understand you correctly? Maybe you could re-explain what the intention of this 6 months is.
And then Latanya says, what is the best way to handle doctors that had test results that they knew were abnormal since April? I'm assuming this is this year, yet did nothing until other doctors months later said it could be the thing that the abnormal test was looking for. Not sure what that means, but I no longer trust my doctors and I feel like giving up. I have Sjogren's disease, Behçet's, Behcet disease.
Beckett's.
Beckett's, thank you. And dysautonomia.
Dysautonomia.
Yes.
Dysautonomia.
Thank you. And then the autonomic testing is what was abnormal. Now, months later, they care. I am kind of over it. I'm tired of being told it's mental health only for them to change their minds when other doctors agree it's physical.
Yeah. So I don't obviously know all the ins and outs, but it sounds like you're dealing with a series of very challenging health problems and hard to diagnose diseases that oftentimes have symptoms that are not specific to that disease. So for example, what I mean by that is, I'm not saying that this is your case, but like dizziness. Dizziness is not specific to Sjogren's, um, but it could be one of many things that you're experiencing. So it's not really clear to say, okay, you have dizziness, so therefore you have Sjogren's, because there are all these other possibilities that have to be investigated. And it sounds to me, based on what you're saying, if I understand you correctly, that the doctor did the test for the dysautonomia in April and got a certain result and never got back to you. And then it wasn't until you went to another doctor that they said, oh, wait a minute, hey, this test shows this could explain what your situation is. So, you know, I'm a big advocate of communicating as opposed to giving up. And I know that's easy to say when you have symptoms that you're living with every day and they're super uh, debilitating and frustrating. But I would go back to that doctor and ask him, hey, why, or her, why didn't you diagnose this earlier? And if they have an acceptable answer, fine. If their answer is unacceptable to you, then that doctor gets fired from your care team and you get another doctor. But I would give them an opportunity to explain themselves, because it might reveal something else that could be helpful to you before you automatically dismiss them.
There's a few more questions, if I don't know how much time you have, but if
Yeah,
you have
no,
time,
I'm
maybe.
here. I'm here.
Okay, so if a patient is diagnosed with both severe coronary artery disease and a large abdominal tumor, which two surgeons from the diagram would most likely collaborate, and how would their roles differ during treatment?
Could you repeat the problems again?
So it's severe coronary artery disease,
Yep,
and the person has a large abdominal tumor.
got it. So what needs to happen, sort of, the problem is the tumor probably needs to be removed, and they might be concerned about operating on the person because of their heart condition. So the people that should collaborate are the cardiologist or the heart doctor, the vascular surgeon or the cardiac surgeon, one of these two, who can help to relieve the heart blockage, okay? So that the person is then healthy enough to have the surgery to remove the abdominal tumor. That surgery would either be done by a general surgeon, or depending where the abdominal uh, tumor is, or a colorectal surgeon, if it's in your colon. So I would say you first have to get the heart situation taken care of, so that there's no risk in doing the abdominal surgery. In addition, you also will probably be seeing an oncologist to figure out, what kind of tumor it is, how aggressive it is. Does it need to come out right away, or can it wait until the heart situation is taken care of?
Okay, great. And then there's one last question. The person wants to know, like, why isn't massage therapy included as an alternative medicine practice, basically, or therapy?
Only because I didn't have enough room, enough time. Um,
Okay.
but massages, there are several that I didn't include, but they're all in my book. Excuse me, doctor. I've got what? Taking ownership of your health and making healthcare work for you. But just in the time that we had allotted, I didn't have a chance to have a comprehensive list. But yes, massage therapy is very key, to restore balance in the body, to take care of aches and pains in the muscles, to help detoxify, all of the above.
Yes, I'm looking forward to my next one. I know that's for sure.
Yes.
Yes. So thank you, Dr. Clarke. I think this is all great information as usual. Thank you all who are hanging on for just a few more minutes. I have a few things to get through here that I want to share before we leave today. And I think this may answer a question that was in the Q&A box. So yes, we are providing an incentive for those who register and attend today's session, as well as session 4 and 5. So you have to register and attend. So we are offering a special promotion incentive, however you want to frame it. So if you attend all 3 sessions, you register and attend, then you are going to be entered for a chance to win a $100 Visa gift card. And we will do the drawing right after the last session, which is on October 22nd. So hopefully that answers the question that the person put in the Q&A box. And then just as an FYI, again, session 4 is on September 17th. That is where and how you get your healthcare. And then session 5 is financing your healthcare. So I think both of those topics are going to be very important, again, as we navigate through the next year or two. And then we have some upcoming Black Health Network member networking events. On September 30th, we will be in San Diego for an in-person member networking event. We are doing a program in partnership with the San Diego Blood Bank in recognition of Sickle Cell Awareness Month, talking about some innovative technologies for sickle cell patients through precision plasma. So kind of interesting topic and technology. So hopefully those of you who may be in the San Diego area can join us. And then on November 12th, we're going to be in Oakland for our first ever in-person member networking event in the East Bay. So please make note of those 2 dates and share with your friends and family and network who might be in those areas. And always, we want to get your feedback on the session today. So please take a moment to scan. I think Ambria is going to put the link to the survey in the chat if she hasn't already. But we'd love to get your feedback on the session today. What other things you think are important to learn? If you have some additional questions that didn't get answered today, you can put them in the evaluation form. There is an open ended comment box for you to do that or make some additional comments and provide feedback. And then if you want to stay connected, you can connect with us on social media. Most of our social media handles are at your CBHN, except for LinkedIn. You can watch the video again in the future on our YouTube channel and on our webinar archives on the website. Then join us in the campaign to support these programs that we bring to you and to make sure that we're able to continue to help our community. So thank you. I guess it's not too early to say have a good weekend. It's kind of hump day, but we're heading down the home stretch. So have a great rest of the day and rest of the week and weekend. So thank you very much for being here today. And thank you again, Dr. Clarke.